Welcome to Season 4 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Commissioner of Health in Baltimore City. Our goal is to bring scientific evidence and experience to current topics in public health through engaging interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith Rogers, producer of Public Health on Call. Today, in a bonus episode during Suicide Prevention Week, Stephanie Desmond talks to Amelia Noor Oshiro, a PhD student at Johns Hopkins, about her research into Muslim Americans and suicide and why this group has been long overlooked. Let's listen. Amelia Noor Oshiro, thanks so much for joining me.
Thank you for having me, Stephanie.
So you study suicide prevention in Muslim Americans. Tell me why this has been such a neglected population.
Absolutely. I think that Muslim Americans in research are underrepresented right now in the scientific literature. And when you look at the history of understanding publications and how the scientific research world works, it really comes down to funding. Getting access to funding allows us to actually conduct the research that we need to do. And it's been historically very difficult to attain funding for Muslim Americans, at least in terms of federal funding, because much of the research can focus on, two different directions. We can focus on perhaps religious or cultural factors, and then we can focus on factors that are outside of that realm. And the religious factors aren't really a big, interest in the mainstream understanding of science, right? We've always known that science and religion have kind of been at odds with each other. And so the cultural factors are of interest. However, we need a strong scientific argument to get the dollars. And at the moment, it's been difficult to try and find that argument without actually having funding to actually conduct the research. So it's been a very circular process. And I will kind of caveat that a little bit by saying that, Muslim Americans, although we are not new to the American landscape, we've had, immigrants, really a influx of immigrants since the 1960s. And so we're only now really kind of getting onto the map and really our issues have gotten onto the map, I think, post 9/11. Unfortunately, even though we don't want to really associate with that narrative, it has brought a lot of attention to Muslim Americans. And with how slow the research world is, it often takes time, often decades, before people really get onto the map. So I think that's one reason.
So what kind of gaps are there in the literature? And also, why is it important to study Muslim Americans and mental health in a different way than, other groups?
So in terms of gaps in the research, when we think about Muslim mental health, that in and of itself is a new concept. I mean, the field has existed, but as a cohesive kind of topic that we can publish on, the Journal of Muslim Mental Health only came about 15 years ago. I think studying Muslim Americans is extremely valuable, not just in terms of representation, right? In terms of getting a more diverse research population involved. It's actually more about understanding intersectionality. And so that's kind of where my research comes into play, because I argue that Muslim Americans have such multidimensional identities that there's, a race factor being, largely racial minorities. There's a faith factor with being a minority faith and one that is highly stigmatized. And then you have the immigrant factor. Not all Muslims are immigrants, but the vast majority of them are of immigrant origin. So you've got, the conferring of different mechanisms of oppression really working at once. You've got the racism with the racial minorities, you've got the faithism with being a religious minority, and then you've got the nativism with being immigrant origin. And I think that particular profile, while it may not be, applicable across different groups, and some people do argue that it's a very niche population. I argue that the broader themes are evident across racial groups, right? And minorities, if you just think about racial minorities, you have so many different sub identities and subgroups that, people are parts of different communities. And oftentimes those identities are not exactly welcomed. They're often stigmatized. So even just on the immigrant identity alone, right? You have the Latinx population and the Asian population, which are huge growing demographics in the United States right now. I mean, India is the top country of origin for immigrants today and has been since 2017. So what we're seeing is a large influx of second generation youth and immigrants becoming kind of the dominant demographic in the United States. So from my perspective, I'm looking ahead. I'm looking, 20 years ahead, 30 years ahead, thinking about what the future of America could look like and how we can prevent suicidality and not just the Muslim American population, but take away insights that can apply broadly and cross-cut across groups.
So this isn't just a scientific endeavor for you. It's personal. Tell me about that.
Absolutely. So I am a proud survivor of a suicide attempt. And I do believe that so much of my personal lived experience with discrimination, particularly Islamophobic discrimination, as a brown Muslim woman, has played into my own experiences with mental health. I came into the field of public health in 2015 as a maternal mental health major. And I thought that I was going to do work internationally and work in humanitarian causes. And at the time, there was so much anti-Muslim rhetoric with the pending Trump election on the corner that we didn't know was coming. I felt personally affected by it. I felt like there was a rise in Islamophobic violence and hate crimes. And at the time, I was also wearing hijab and I was a visible Muslim. And I thought to myself, I know that I'm going through so many of these stressors that are specific to me being a minority. I can only imagine what it would be like for other Muslim Americans. And so I was in grad school, I was doing my master's, and I decided to change my entire course of study to get at this question, like, does being a visible Muslim impact your exposure to Islamophobic discrimination? And does that in turn have any relationship to your mental health? And that question is what ultimately led me to doctoral studies here at Hopkins, and ultimately led me to do the Trauma and Violence Fellowship through the NIH, and got me into suicide work. And I had no idea until I had started kind of networking within the Muslim American community. I had no idea that this was actually something on the ground, anecdotally, an epidemic within our community. I had found out that there was a woman in the Bay Area, California, who had started a suicide helpline for specifically Muslim American youth. And I had, after speaking with her, found out that there had been locally in her community around 3 suicides of brown young Muslim men. And I thought to myself, I knew I wasn't the only one. There had to be other people. And as we've seen in the news cycle, I mean, there was recently a murder suicide in Texas of a young Muslim family who was also brown and immigrant origin South Asian. To me, I'm seeing this from a grassroots perspective and seeing on the ground, like, wow, this is something that's happening in the community. But then as a scientist, I'm thinking, how can I get empirical evidence, data to support what I'm seeing anecdotally? So that was really the question for me, was how can I marry my personal experience from a scientific lens into some kind of research proposal?
Mm-hmm. And so what questions are you asking?
The questions I'm asking is, if we are so stigmatized as Muslim Americans and so affected by structural violence, how are we maintaining a sense of belonging, a sense of acceptance, and how are we maintaining our mental health and well-being? Because we know from previous research on groups that have been highly stigmatized for their identities, particularly queer folks, right? LGBTQ identifying folks have the highest rates of suicide almost anywhere in the world, regardless of what country really you're looking at, mostly It's the countries that have strong laws against openly identifying as gay or lesbian, et cetera, even trans, right? So when we think about those populations and what it means to be rejected by society, there's so much violence toward queer folks out there. There's so much hatred that ultimately becomes internalized into self-directed violence. And that's actually the definition of suicide. If you look at how suicide is defined, it is understood as self-directed violence, which is, manifested as injurious behavior toward yourself with the intention of dying. So to me, I think about broadly, how are we looking at how oppression works and how discrimination works and how violent systems of Islamophobia and racism work to ultimately make people feel othered and have suicidal ideation and attempts.
So do you think Islamophobia played into your suicide attempt? Or is it something that you kind of didn't really understand at the time?
I think Islamophobia, like any mechanism of oppression, absolutely plays into violence of all sorts. We're talking homicide, suicide. I do not doubt that it was the main ingredient for a lot of my experiences with violence. And in terms of it, being directly something that caused my suicide, what I explain to people is it's kind of like saying, does smoking cause cancer? Well, we know that there's a strong correlation. And of course, as a scientist, I'm not allowed to say it causes cancer, right? But I am going to say that, smoking one cigarette isn't going to kill you, but over time, with enough incidents, you're going to get that lung cancer. You're going to develop that tar in your lungs. You're going to feel difficult to breathe. It's going to be difficult to feel like your body has a safe place to process everything. So that's kind of how I understand trauma. And even if you look at the research on what we call race-based traumatic stress, there is evidence linking to epigenetic mechanisms that essentially change your genetic code and make it so that your body is less able to process stressors from the outside environment. And so, we always talk about, microaggressions and these small things that people don't necessarily consider racism, but over time it weathers you down and it brings an allostatic load, or essentially throws your body off balance and off homeostasis. And so that is definitely a contributing factor. And in my view, a main factor of why health disparities exist.
So tell me, when it comes to Muslim Americans, are there unique risk factors for suicide?
I do believe as Muslim Americans being a minority group, there, just as any other minority group, there are unique risk factors. Unfortunately, because we haven't had a chance to really study what could be those contributing factors, we don't quite know what they are yet. So that's where my research really comes into play. And I'm really excited to share that my research as a Muslim American, I'm the first Muslim American to be funded by NIH to do research on Muslim mental health, specifically on suicide prevention. And I think those are the questions that I'm going to be asking. I'm going to be asking the community, what do you think from your perspective are the unique risk factors? Because they're the ones who are really going to have the answers, not me. In terms of why this matters and how timely this is, I have to say that we're in Suicide Awareness Week. We're going to be bringing awareness to this issue, yet in my population, in my community, this issue is not really, we haven't raised enough awareness on it on the ground, let alone within the American public. So I feel like in both directions, there's this need to really get aware and bring attention to the fact that suicide does exist in the Muslim American community. And we should be paying attention to it because of how much Islamophobia has been such a central part of our narratives, whether we like it or not. I mean, we also have on the Suicide Awareness Week on Saturday, 9/11 is going to be happening. That's the 20th anniversary of 9/11. And it happens to be falling on Suicide Awareness Week. And I think I am placed at a unique intersection to be able to share not just my lived experience, but also my scientific research in trying to uncover some of those questions of what really are the risk factors.
Amelia Noor Oshiro, thanks so much for joining me.
Thank you, Stephanie. It was great being here.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.